Welcome to the MRCS Bites session on biliary tree and gallbladder. Today, we'll dive into this topic and explore the common questions tested during the MRCS Part B exam. For more information and full course, please visit mrcsbites.com. Ducts within the system. The biliary system is divided into intrahepatic and extrahepatic systems. The biliary tree starts as bile canaliculi, which divide into bile ductules and small interlobular tributaries of the bile ducts. These join each other to form larger ducts. The right hepatic duct drains the right lobe of the liver, and the left hepatic duct drains the left lobe. These two ducts leave the liver at the porta hepatis to become extrahepatic. They amalgamate to form the common hepatic duct. Distal to this, it accepts the cystic duct, and at this point it is called the common bile duct. The common bile duct travels with the hepatic artery to its left and the portal vein behind it in the free edge of the lesser omentum at the porta hepatis. At its most distal aspect, it accepts the pancreatic duct. The common bile duct terminates at the sphincter of Oddi/ampulla of Vater. This structure is identified as a papilla in the second part of the duodenum and is cannulated at endoscopic retrograde cholangiopancreatography, ERCP. The sphincter of Oddi opens into the medial aspect of the second part of the duodenum, the common bile duct. It is 8 centimeters in length. It has a 6 millimeter upper limit of normal diameter, but gets 1 millimeter larger every 10 years after the age of 60. It is also larger post-cholecystectomy. It travels in the free edge of the lesser omentum, in the porta hepatis, with and to the right of the common hepatic artery. Both of these structures are in front of the portal vein. What is Pringle's maneuver? Pringle's maneuver involves placing a clamp over the free edge of the lesser omentum and occluding the vessels described above. It is a useful, temporary measure for controlling heavy bleeding from the liver, e.g. in trauma, by occluding the liver's blood supply because it can be done quickly. What is Callett's triangle? It is a triangle formed by the liver, common hepatic duct, and cystic duct. The cystic artery runs within it. It is important in identification of this structure at dissection in a laparoscopic cholecystectomy. Histological layout of biliary system. The liver is divided into functional units, or lobules. At the periphery of each of these are triads of tubes: bile ductule, terminal hepatic artery branch, and terminal portal vein tributary. These are the portal triads. Each lobule has a central terminal hepatic venule. Blood flows from the portal triad, portal vein and hepatic artery, and in the sinusoids to the central venule from the periphery of the lobule to the center. These venules then transport blood to the hepatic vein. Bile flows through the canaliculi in the opposite direction to the portal triads peripherally. Gallbladder. Pear-shaped viscous. Lined with columnar epithelium. Contains some smooth muscle in the wall. Can hold 50 milliliters bile. Consists of fundus, body and neck. Lies in the gallbladder fossa attached to ventral surface of the right lobe of the liver. Neck is continuous with the cystic duct. There can be a small diverticulum at this point, called Hartmann's pouch. Stones can impact here. Arterial supply, cystic artery. Venous drainage via small veins into the substance of the liver. Lymphatic drainage to cystic node in Callett's triangle. For more MRCS Part B resources, please visit mrcsbites.com.